In the Know, it's our new podcast focusing on the health of people in Knowsley. And today we're focusing on winter vaccinations, flu, COVID, and actually other ways that we can stay well through the colder months. I'm Sarah McNulty. I'm Director of Public Health for Knowsley. I work at Knowsley Council. And I'm just going to ask our guests today to introduce themselves.
Hi, I'm Ali. I'm one of the nurses at a local practice in Kirkby, and I administer the flu and COVID vaccines, amongst other things, in my job.
Hi, I'm Hassan. I'm the clinical director in Kirkby PCN, and I'm a pharmacist by trade.
Hi, I'm Heather, and I'm a patient at a health centre in Halewood.
So we're here today to talk winter, which I would say feels well and truly here. I'm sure our audience are more than aware of the increase in winter bugs circulating at the moment, and flu is certainly with us at the moment and a little earlier than usual. But there are lots of other viruses available this year too. So it's really timely that this podcast looks at winter vaccinations and why they're important, how people can access them. And we're also going to try and do a bit of myth busting too. So I'm going to start with Hassan. So can we just begin with the big picture? So why are winter vaccinations so important here in Knowsley? And what are you seeing locally in terms of flu and COVID risk this year?
Yeah, I mean, the main problem is that I think people don't realise that we have certain viruses, etc. You get immunity once you're exposed to them for a long time. But with COVID in particular, it only lasts 6 months, the immunity. With flu, less than 12 months. And these are the viruses who sort of change the way they look to the body. So your old immunity doesn't work with them as good. So you need to be able to top them up every year. Unfortunately, we are living where we are post-COVID. A lot of people think that, oh no, I've already had the vaccine. But it is not. It's just your body needs to be able to defend itself. And all you're doing is, I usually to patients explain to them that your body immune system is like having an army in there. And if that army is not there to fight the viruses when they arrive, you're not going to win. So the virus is fast dividing itself and it's really virulent, but the body's immune system, if without the vaccine, doesn't have enough soldiers to fight them. And basically what we need to do is that increase the number of soldiers to fight these bugs. And the only way we can do that is that by giving our body a little boost, by having the booster COVID or having our seasonal flu jab. And I think people like Heather, who are, I mean, I've known Heather a long time. I won't expose how old she is, but she's now north of 50 anyway.
Certainly.
so as you get older, your immune system drops. And, without that vaccine, she won't be able to fight those viruses when they arrive to her, And you pick it up anywhere. I mean, you could be going to Tesco's or not mentioning any other supermarkets, you could go to shops, on the bus, on the taxi, you just pick it up anywhere. And, it's important that obviously we keep hygiene and hand washing and sneezing, using tissues and getting rid of it. But still, it's in the air, and you could go into a room and pick it up.
Okay. Or someone could bring it into you.
Exactly.
Yeah,
because we do have housebound patients that sometimes say, I don't go anywhere, so why should I have it? And it's like the carers are coming in, your family's coming in, there's people coming to your house all the time, so don't think you won't get it.
So we can talk about each individual vaccine as we go on, and just talking about kind of viruses in general, winter in general. Lots of bugs around, lots of opportunities for bugs to infect us. It's colder outside, we tend to be indoors more, we tend to have our windows shut more, don't we? So that tends to increase our risk of spreading viruses to each other. So, I mean, what main challenges are you seeing at the moment, Ali?
Challenges to people taking the vaccine or to getting ill?
I'd say getting ill. We can go through the vaccine.
Well, I think people don't eat properly, people don't exercise properly, and good diet and being active strengthens your immune system so much. And I don't think people necessarily realise how influential a good lifestyle is. And there are reasons why people can't always do that. Fresh fruit's expensive. Sometimes people can't cook. Sometimes people have got very low mental health and therefore they can't cook, or they're no longer able to cook because they've got other medical conditions that have affected their ability to stand at the kitchen or something like that. So there's lots of reasons why people don't do the things that can best look after themselves, but it's something that I encourage all the time, all day long. I'm like a broken record. Go out, do things,
don't forget
chair
the basics.
exercises, really basic things of looking after themselves, going for it. And then, like you say, being outside, going outside. There's a lot of evidence about being outside in the winter. Wrap up, get outside. There's a lot of evidence about how it strengthens your immune system and how it can make you a little bit more robust. And stress. I mean, loads of people are in really stressful jobs now, and that can affect your immune system as well. And then, of course, we know that the vaccines are available to people who have got lots of problems, lots of health problems. And that's because we know that they're not as able to fight these things off, whether that's diabetes or a chronic lung disease, or they're immunosuppressed for some reason. There's lots of reasons why your immune system isn't quite as strong and you haven't got that army. I like that analogy. I'm pinching that one.
That's good. Yeah, good point. Prepare for winter all year round, I guess.
Yeah.
Be as healthy as you can.
Yeah.
I guess also, don't forget, wash your hands, basic hygiene.
Oh, totally. I mean, there's
catch
nothing...
it, bin it, kill it, all of those sorts of things.
We're going back to Florence Nightingale now, but, those basic things of washing your hands where you go, especially before you eat, especially before you prepare food. I'm much more conscious now about handrails and, I've got my hand gel and, making sure that I'm not touching my face and things like that. So, yeah.
Without restricting your life.
Totally.
So, Heather, how are you preparing for winter?
But I've had my flu jab already.
Well done.
In advance, knowing that it's out there. Plus the fact with being a carer for my mum, if I go ill, who's going to look after my mum? And I've always looked at that side of it. You've got to look to the future and prepare yourself. Somebody's created these vaccines, not just because they wanted to, because it's a necessity, I think. And I agree with Hassan. If you've got something going to attack your system, you need the army there to fight it off. It's normal from that side of it. And going for the flu jab, I see it as a valuable tool in my armour to help me. They're not you guys aren't giving the vaccines for your health. It's for my health and for other people around me, because if we can stop it in its spread, then it saves sick people. I mean, you could be going and seeing a sick relative or anything like that, especially this time of year. Family together, you're going to go and see your great aunt. Have you got anything flu? You're going to pass it on to him.
We mingle
and then you've
a
got
lot,
to live
don't we?
with the conscience of passing it across to them. So, and it's that side of it. So no, I'm a great advocate of having a flu jab to protect me and elder relatives as well.
Okay.
And that was quite a good point Heather just made, because I mean, this is why we encourage that children's flu vaccinations, which is sometimes is poorly taken up as well.
Yeah.
Because the children's flu vaccination is not about necessarily protecting the children. It's about protecting the grown-ups who look after those children.
They're very good spreaders.
They are.
Yeah.
They love to share all their snotty noses and their coughs.
And
it goes back to those basics you were saying before. Kids aren't good at washing their hands and blowing their nose and putting it in the bin. They love to share everything with them, and they will. And if they may not go and see old granny, but they'll see mum, who then goes to see old granny, and that's how it spreads.
Well, I've got two grandchildren, one's 7, one's 3, and as soon as they see me, they jump and give me a big hug and give me a kiss and everything. Obviously, if they've got flu or whatever other bugs, they easily pass it to me.
Yeah. And you do want to hug them, don't you?
Oh God, yeah.
The other thing is, once a child goes ill, what do they want? They just want cuddles. They want snuggles. So, of course, you're going to be in that line of fire. So the children's vaccines is...
and then you've got parents who might need to take time off work. And we all know how difficult that can be. Some employers aren't as understanding as others. So your child goes off sick and you have to look after them. Then you catch it from them and then you're... So it can go on. And
and then if you've got an employee who won't give you the time off, you've got to go into work. It gets passed through the air conditioning in the system. So, and that's how it just... It's rife, and that's how
why
it
we've
takes
seen
advantage
And that's why we've seen cases rise.
Yeah.
So we are talking about the flu vaccination at this point.
Yeah,
So Ali, if you could just go over for us who is eligible. You've touched on it a little, and we've mentioned children a little bit there.
Children, so any children from 6 months onwards that have specific medical conditions, and if you're not sure what they are, just go and ask your GP practice. They'll support you in that, or your local team who look after you. But we can give flu vaccines from 6 months of age to children who are in need. The general thing is children that were 2 years old on the 1st of September, right the way through to being in year 11 in school. If they're in school, school will go out and give them, and I know some of the schools have had them a little bit later this year, but the vaccination team is going out and giving those vaccines. And there are 2 vaccines. So the live vaccine that's a little squirt into the nose, really easy. I love to play games with the children doing that. I tell them it's fairy dust so that Santa can find them. And, it can turn into a game. It's really not that bad at all. But there is some porcine gelatine in it. So sometimes we give an injectable vaccine to the children that can't have that. And so there is always an alternative. Don't feel that you can't have that vaccine just because you've heard about that. And then for adults, again, anybody who's immunosuppressed, who's on certain immunosuppressive medication, or they've had certain treatment that's knocked their immune system, they're eligible for a flu vaccine. If you've got a relative that's living in a nursing home, they're eligible for a vaccine. And anybody over the age of 65, or if you're 64 but you turn 65 before the end of March next year, then you're eligible for a vaccine.
And pregnant
ladies, sorry. Yes, I've been doing pregnant ladies since the 1st of September. Yes, pregnant ladies are very important too.
And people on long-term conditions under 65, like asthma, COPD, diabetes, the usual.
Yeah.
So we've talked a little bit, haven't we, about how vaccines work, that little army, soldiers like that. I like that too. Do we know how effective the flu vaccine is?
I think, apparently there is a variant of flu virus about at the moment that hasn't been used in the flu jabs for the past 2 or 3 years because it wasn't circulating. And this is now in the mix, and that's reduced the effectiveness of vaccine apparently from 60 to 70% down to around 40 to 50%. But I mean, if you was going to dodge a bullet, I'd rather have a 1 in 2 chance of dodging the bullet than getting it 100%.
Yeah.
So that's really important that, still you get some boost in your immunity. You're still producing soldiers. Might not be for that variant of the virus, but still there would be some defense in your body. Especially the over 65 vaccines is particularly good because they've got an extra bit added to them for the over 65 in the vaccine when they make it. They call it adjuvant, which basically means that it boosts your immune system to be able to produce these extra soldiers.
Helps it stick a bit, doesn't
it? That's it, make it work a little bit better. So over 65s, even without the flu, that extra bit actually boosts their immune system. So really, if you're 65 and over, or as you said, you're becoming 65 by next March, it's a no-brainer to have the vaccine, honestly. I vaccinate, when I run my clinics, the busy clinics, I run, for example, I vaccinate roughly about 1 every 2 minutes. Okay? So on a busy morning, I do about 200 on my own.
Wow.
Yeah? I have 3 lanes of patients coming in, 1 every 2 minutes, and they in and out. And it's that easy. I mean, literally, before they sit down, they're out. It does not hurt them at all.
Yeah.
No.
Lots of people come in like this.
And I think that's a point, isn't it? Because we're going to do some myth busting here today. But people will have heard that flu vaccine isn't working this year, all of that. And it's not that it isn't. It might be slightly less effective for some people. But also we don't know whether, it's making... So we had a conversation just before about the flu vaccine actually making the disease, if you get it, slightly less severe as well.
Absolutely. So it's going to, it might not completely prevent you from getting it, but your symptoms are likely to be a lot more manageable. Yeah. And that's especially important to those people who've got underlying conditions like chronic lung diseases and diabetes, and people who struggle to fight those things because there's other stuff going on. if you can just make those symptoms a bit more manageable and keep them out of hospital, no one wants to be in hospital, despite whether it's Christmas or not. You don't want to be in hospital.
The other thing is, it will help your body as well, because whilst your body is trying to fight the flu, it's not going to be able to fight side effects from your other conditions that you're already living with as well.
Yeah, it's going to make you worse.
So it's going to make you that little bit worse if you've not had it, and your body's sending the energy to fighting something that you could have fought with the flu vaccine and given it that little bit of a boost.
Yeah.
And it's preventative treatment. If you've got a chronic lung disease and you end up in hospital with a exacerbation of your COPD, and because you've got this overwhelming infection, even if it's okay and they can treat your symptoms and they can get you better, when you get home and you recover, you probably won't be as good as you were when you went in.
Yeah.
Because that lung function's going to get lost. So this is preventative. We know that every bad infection, and the more old you are and the more fragile you are, if you end up so ill you end up in hospital, you're not going to be as strong when you come out again.
No, you never regain what you used to have.
Yeah.
And the other myth maybe we should bust is that antibiotics don't work against viruses.
They don't.
Yeah. Antibiotics don't work against viruses. So, people say, oh, I've got the flu, I'll ask for some antibiotics. You might as well drink this water. It won't do any more good than nothing, and you're just putting an extra drug in your body. That's not going to do you any good. And also, I don't want to really go down the route of the antimicrobial resistance, but you are going to actually stop yourself being able to treat it when you actually get a bacterial infection because you've took the antibiotics for the wrong reason. So really, all these link together. And as Sarah said, the hospitals are getting busy this time of the year. Actually, going to hospitals, you are going to pick up more than you went in with, So you want to try to stay as well as possible and stay at home where possible.
Yeah, definitely. Yeah. Just thinking about that other myth that actually your immune system is better than a vaccine as well. Well, pretty much all of human history would tell us that that's not right, would it? Infectious diseases have been haunting us as the human race for many, many, many years. And the more we're exposed to,
the better and the stronger the immune system becomes. But this is why if people have certain cancer treatments and they have certain types of chemotherapy or they have bone marrow transplants, they need to restart all their childhood vaccines because their vaccination system becomes like newborn babies. Now, there wouldn't be a need to revaccinate you from all of those things if you had a robust immune system because it's brand new and it's fresh and it's clean. But it's empty. It's got no memory. It can't remember any of those things. So you've got to start all over again with all of those vaccines. Because what we're doing by giving these vaccines is giving knowledge to the immune system. It's providing it, as you say, with more soldiers. But those soldiers have got weapons, they've got knowledge, they've got ability to learn how to fight those things. If you put me in an army uniform and gave me a gun, I wouldn't know what to do with it. You'd have to train me how to do it. So we're training the immune system all the time with these things.
Without having to get a pretty nasty disease.
And if you get the disease, you will get immunity, and you can get some very good immunity from picking up these diseases. But why would you want to take that risk?
And especially if you're vulnerable, like you say, why would you?
Well, not only that, because you say about the disease, Hassan mentioned before, the diseases are always mutating and finding. It's like with the army. The army starts off with simple bayonet and rifles. Now look at the weapons that we use in that. So it's the same with the viruses. The viruses are constantly evolving and updating. So we've got to get our bodies to update as well.
They are clever, but we can be cleverer, can't we?
We need to be.
Okay, so the other vaccine that we give to certain members of our population is the COVID booster again, and we've got a COVID booster programme this year, and each year there is new guidance on who's eligible. So
it's not
who's
helped
best
this year. Put it this way, because it actually affected our delivery this year. Because all the previous years, if you were eligible for flu, you were eligible for COVID. This year they changed the rules. I'm not going to get into politics of NHS, why that happened, whether there is funding may be an issue, I don't know. But anyway, this year, they've made it 75 plus or immunosuppressed.
Yeah.
If you had any of those vulnerability of other conditions, you didn't qualify. I had many a conversation about this.
Me too.
Yeah,
And that might change.
Yeah,
They
it might
decide
change.
each
Yeah,
every few months, don't they, when the booster
so
comes.
this year's advice was 75 plus, which actually meant that our practices that I look after roughly collectively about 65,000 patients, plus most of the housebound patients on our patch in Knowsley. So it meant that by the end of October, I had vaccinated all the care homes. I vaccinated majority of the 75 plus with both flu and COVID, because it was a smaller cohort to bring them in. Whereas previously, when it was open to everybody who was included with flu and COVID, some of the slots for the older people was taken up by the younger people who qualify. So the rapid vaccination period was much shorter this year than previous years. But it also meant that our uptake of flu for some reason this year for under 65 is not as good. Because
I agree.
I've run out of over 65 flu because I linked it with my COVID vaccination, and I had to keep shifting flu from one practice to another practice to satisfy the demand. But for under 65s, I've got fridges full of the under 65s. So I might, now that there is this surge, I may, don't hold me to this, by the way, on this podcast, next week I might do a rapid clinic at 2 or 3 locations and just send a walk-in service. I'll have to see if we got enough staff to manage that demand. If we have, we hopefully try to hit all those under 65s and get them vaccinated for the flu.
We seem to order less flu each season because like you say, you have vaccines left in the fridge that end up going in the bin, and that's a waste of resources. But you want to make sure you've got enough to cover everybody, so you always have some left. But the under 65s, over 65s, we haven't got a lot left of, but we've got quite a lot left of the unders as well, and trying to get some of the younger people to have their vaccines because they're vulnerable and they have got a condition is quite challenging sometimes.
But to be honest, community pharmacies are also vaccinating both COVID and flu, which is good, which is really helpful because you're attacking the whole population from all different angles. And I've got a suspicion, I've not actually researched it yet, but I have enough knowledge of how community pharmacy works that to think that the under 65s, if they are working, it's easier for them during the lunch hour, nip to the local pharmacy near where they're working, get the jab done, rather than take a day off to come to the GP practice. Do you know what I mean?
It is, but I'm having conversations with people in front of me when I can give them the vaccine there and then, and they're still saying no.
So why are they saying no?
There's lots of reasons. So some people feel they are fit and healthy and, I'm all right, I've never had flu. That's a common one. I've never had flu. And I say, well, if you haven't, you're lucky, but that's luck because you've just not been near somebody that's coughed over you at the time when they've had it, or your immune system has managed to withhold that particular strain for you because maybe you've been exposed to it before. But why take the risk? If you get in a car, you put a seatbelt on. You put a seatbelt on not because necessarily you've been in a bad crash, but because you know there's a risk there. Also, the police will tell you off if you don't put your seatbelt on. But most of us do it knowing that it will protect us, so why wouldn't we put the seatbelt on? This is the same. Yeah, you may not have had a bad flu in the past, but you may get it. But also, as Heather's pointed out, you may want to go and visit your granny, your friend, lots of people. You may sit on the bus or in the theatre next to somebody who's really badly immunosuppressed. Do you want to be responsible for the fact that they've caught that and ended up in hospital with pneumonia or septicemia or died? I don't think most of us would want that on their conscience. So there's the thing about I'm fit and healthy and I don't need it, which is very inward looking. There's a lot of mistrust about vaccines in general, which is really sad. The internet is a fantastic place to find information and there's loads of stuff on there. But as we're seeing in all these news stories time and time again, there's a lot of misinformation on there and a lot of AI stuff on there that looks really genuine and really convincing. And particularly when I'm talking to parents is attitudes towards vaccine. Their children are the most precious things in their lives, and I do not believe that the vast majority of parents turn away vaccines because they want to be awkward or not told what to do. They come from a place of protection, and somebody somewhere has put the fear of God into them about this vaccine and what this vaccine might do, and so they don't want to have vaccines sometimes, and they see flu as being quite a minor one, particularly because all kids get coughs and colds, and it's not, and things like that. But I find it hard to have that conversation sometimes because they don't want to engage with it. They'd rather trust what they've seen on TikTok or Facebook, or what their friends told them or their family members told them. And I'd really implore people to ask somebody that knows. Ask a pharmacist, ask a nurse, a GP. Ask somebody who's read the research and understands it, rather than somebody who's just passionate about their subject but doesn't really understand it.
And I think
going on from that point, my mum was quite surprised. Several years ago, she was speaking to our GP, who has retired since, and he actually said to her that tens of thousands of people die each year from flu, which surprised both mum and I. That you don't realise that you can die from flu.
Yeah.
And looking at that, you're thinking, if we can prevent those deaths, everything was going on with COVID, with why didn't we do this, why didn't we do that, to prevent the deaths. But this is an ongoing. Flu's been around for a long time, and people are still, with that math side of it, not getting vaccinated when they can prevent the deaths. Yeah. They can extend their lives. Yeah. So why wouldn't you? And as I say, knowing that statistic is actually one of the reasons why I decided to keep on going and have my flu jab every year, because at that point I didn't know just how big a problem it was and how many people did die per year from it.
Yeah, most definitely.
And people don't believe that you can die from flu, but you can.
Yeah.
I mean, we're lucky here in this country. Flu is free of charge, the flu vaccine.
Yeah.
Okay? In some countries, people actually have to pay for the flu jab. And in those countries, actually, there is queues for people who want to pay and get it. Because I think sometimes we think that the state wants to vaccinate us for some odd reasons, you know. You know what I mean? It's nothing about, it's just the state, the Department of Health or NHS wants to protect you, because when you become ill, NHS looks after you. I mean, everybody understands with NHS, that's the good safety net we have in UK, in England, is that if we become ill, NHS services are excellent to pick us up, fix us, and send us back home. Yeah. Whereas, you know, they want to make sure that people, the offer of vaccination, totally at free of charge at the point of going to your GP, pharmacy, etc., is there to stop you becoming ill, and then them having to pick up at the other end that the people who are ill. I mean, this morning I was on Breakfast TV. They said last week more people got admitted to hospital for flu than the whole of winter last year.
Yeah.
Okay.
Wow.
So you're just showing you that the impact of that's going to have. And then we got these doctors potentially a strike happening. Do you really want to be in hospital next week or the week after when the doctors are on strike with flu, when you could have prevented it by having the jab this week? That's the question.
You know, there's a lot about corridor care and things in A&E, and how many hours or days people can wait for a bed in hospital. And some of that is made worse by the fact that there's people who could have had a vaccine that chose not to have a vaccine, and they've ended up with flu and they've got hospital. So, you know, while you're sitting with your heart attack and you're waiting for a bed, some of that is being held up by the winter flu, COVID pressures, while people are not preventing, not doing their best to prevent it. And it's quite sad, really.
Like what I was saying, isn't it? Prevention's better than cure.
Absolutely. NHS was set up for prevention, and all healthcare professionals feel very passionately about prevention, which is why I go back to talking about eating well, exercising.
Oh, yeah.
You want to prevent things, you want to look after. We get one body. You wouldn't take your car to the garage and put rubbish in it, would you? You put petrol in it that you know is decent. You know, you wouldn't have a baby and buy the cheapest milk you could find to feed it with, thinking, oh, well, it'll do. You want to provide the best. Why do we not do that with our bodies
ourselves.
and look after ourselves? It's prevention, and vaccination is just part of that prevention, and it just stops so many illnesses.
Yeah. And we were talking a little bit about COVID vaccination, which I think, you know, when you think about the myths around COVID vaccination, and also you think about, we have seen a drop in all vaccinations since COVID.
We have.
And whether some of that would have happened anyway with, like you say, the growth of the internet and misinformation. And we've seen vaccination scares in the past, haven't we? And we've seen the impact on that. And I don't know whether, you know, COVID just increase the amount of misinformation out there about all vaccines, and people are just incredibly suspicious nowadays.
I think it did. I think it did for numerous reasons, COVID, because, you know, there was an attitude at one point, and it changed and evolved as things do, that you had to have a vaccine if you were going to get on a plane, or you had to have a vaccine if you wanted to go in a nightclub, or, you know, people working for the NHS or nursing homes had to have a vaccine if they wanted to keep. And these rules did change, but I think it made people, I've had conversations with people where it's made them say, why? Well, I'm not being forced. No one's telling me what to do. And that was even without any misinformation. It was that block of. And then they start to look into it because it's become such a big thing. And of course, during COVID, we didn't have a lot else to talk about, you know, unless you're sharing banana bread recipes or whatever. So it was on the news every day. People were at home. They were watching it. They were Googling it. They had time on their hands. So it did become a really big thing, and I think it has accelerated it quite massively. I don't remember having the same conversations with people about vaccines before COVID that I have now, and people will quote things to me about the COVID vaccine, and some of them are just bonkers. I'm trying to think of something that's really daft. You must have heard some daft things in your time. And
I mean, the funny thing is, I've got some patients who actually say, I'm happy to have the COVID jab because I don't react to that, but I don't want the flu.
Yeah.
It's completely opposite.
Yeah.
It's just, it is, I think some people wrongly call it vaccination fatigue. I don't think it's vaccination fatigue. I think it's that case of nobody's going to, like you say, tell me I have to get vaccine. You know, I think it's absolutely a freedom of choice for people, but I think that freedom of choice has to come with adequate information to make the right judgment. And I think this is the problem, is that we are fighting, you know, this podcast probably gets viewed by 20,000 people in Knowsley, okay? But those people who are anti-vaxxers to some degree, etc., they probably got millions of followers on TikTok, Instagram, and all that. We cannot fight that. But again, like using the army analogy, we got to start somewhere. So this podcast hopefully would inform some of our patients who are in Knowsley to say that, you know, vaccination is only there. We only offer it to help you fight the disease. We're not here. We don't gain anything by vaccinating you. If anything, during October and November, this year I've vaccinated just short of 8,000 patients. Yeah. During those, I could have done a lot better with my time. Yeah. Do you know what I mean? You know,
there's much more interesting things to do. Yeah, definitely.
But you know, I was seeing 200 patients a day for several weeks, and then visiting every care home in Knowsley, arranging for housebound patients to get vaccination, etc., etc. All that is a lot of coordination and organization needs to happen. My life will be a lot easier if we said, you know what, this year we're not bothering with it. But it's not that I'm only doing it not because I gain anything from it. It's so that I know that those patients don't become ill, and then we need to provide additional services to make them better. Because if you become ill and you come to your GP surgery, we're going to try to do our best to make you well. But if you could have prevented it, that would give gap for somebody else who becomes ill from heart attack or something else to come in.
So not everyone doesn't get the vaccine because they don't believe in it, or they have health concerns. Some people don't get the vaccine because it's difficult for them to understand how to access it or access it. So how do people get their winter vaccines?
Okay, there's the two main routes in England. We're talking in England now. In England are through your general practice and through your community pharmacy. Both cohorts can see all patients.
And that's for flu and COVID?
No, for flu and COVID, but not all GP practices can do COVID, and not all pharmacies can do COVID, because for COVID, you need to be registered your base, you need to have a certain stuff. Like, for example, where I run the COVID hub for most of Knowsley, in a sense, is that I have my own freezer, I have my own specialist fridge that's monitored. So a lot of stuff needs to be, the cold chain for COVID is a lot more complex than it is for.
So
for
thinking
flu.
about the complicated one first, how if somebody was over 75 and they wanted a COVID vaccine, what would they do?
Well, if you're a Knowsley resident, and even if you're not a Knowsley resident, if you contact your general practice or a community pharmacy, or you can go to there is a site on NHS that you can put your postcode and it gives you the nearest location that the community pharmacy is available.
Just Google COVID vaccination and it will come up.
It'll come up. Okay.
But in the general practice land or PCNs, we have collaboration agreement where, for example, I hold the vaccine for the whole of population, but then practices come, like in your practice came yesterday.
We got one this morning, yesterday,
so
and I've given 3 of them this morning.
They needed a bottle of vaccine yesterday, so they can
all the patient needs to do is go on Google COVID vaccination.
Or ring your GP practice and say...
And they would know.
And then for flu, it's a bit more
flu
accessible.
Is easier, because flu, all GP practices have flu. Sometimes they do like what called flu clinic. Basically, they just do a block of 3 hours, just flu. But sometimes opportunistically, you come for example, a health check. While you're there, you say, "Do you want your flu?" And, a quick jab and it's done. And then your community pharmacy, some of them run clinics, some of them you can do a walk up to a pharmacy and say, "I need flu," and they fix you up there and then, depending how busy the pharmacist is. But generally, accessing flu, I don't think is a problem. Accessing COVID is not a problem. It's a little bit more complicated, I should say. It's not a problem. And I got somebody, as we were sat outside here, waiting to start this podcast, one of my practice managers rang me saying, "I've got a 92-year-old who didn't contact us about the housebound COVID jab, and he wants this COVID jab." I said, "Okay, put it on the list. I have a special list that people can book in from anywhere in Knowsley, and then when that gets to about six people, I'll arrange for a bottle, because the COVID vaccine is a bit funny. We get it in a bottle. We have to draw it up and make it up. Once I break the seal, I've got 6 hours to use all the vaccines. After that, anything left over got to go in the bin. So rather than... And it's quite expensive. I don't think people realize how expensive COVID jabs are. It's roughly cost the NHS about £100 each.
Wow.
Okay? And so, NHS would not have spent £100 per patient for a COVID jab if they didn't think it's going to be effective.
They didn't have faith in it,
Yeah.
So, but even if you're not eligible for a flu vaccine, you can pay for a flu vaccine as well. I paid for one for my daughter last year. The previous 2 or 3 years, she'd had flu at home. Very fit, healthy, active, 24-year-old. And I just said to her last year, "You get flu every year. Should we get you a vaccine?" Went to the chemist, paid £18, got a vaccine. Did she get flu? No.
Yeah,
exactly.
She got one this year.
Did you find it easy, Heather?
Oh, absolutely, yeah. There was no problems. I spoke to the GP practice, and I knew that the flu time was around, because I always think around about September, I always start thinking, right, the flu jab is going to be
when you get your woolly hat out.
Yes, exactly.
Although sometimes in September it's boiling hot. So,
beginning of September, that's the one you're thinking, "Oh my wordy." But no, it was always around about that time. So they think, right, I'll keep my eye out, keep my ear to the ground, and I contacted the GP practice and booked in to find out when they were getting the flu jab in, and when the clinics were open, and they've got the appointments then and there. So, and I booked in. So, and I did have it actually just before I went on holiday. I'm thinking, am I going to get ill? Because I had it on the 6th of October and I flew out the country on the 13th. and I had no side effects whatsoever.
Yeah.
So, and it's one of those, a lot of people go, oh, I'm not having it because I'll get flu. I've had nothing.
Yeah.
I've had no side effects, not even a sore arm or anything like that.
Yeah. So
And
again,
it was
that's some of those
fabulous.
myths, isn't it?
Yeah.
The common myths are, I'm going to get flu from
Yeah.
it, and we know that's impossible. There
Yeah.
is no way that you can
Yeah.
get flu. It's
dead virus.
Yeah, it's dead.
dead virus,
It can't do that. I think the other one is, you'll get a sore arm, and you might get a little bit of a sore arm for a couple of days, but most
I think
of the
that's the
time,
most common
fine.
thing.
Yeah.
But would you not rather have a bit of a sore
Yeah.
arm than be
Yeah.
locked in bed for several
Isn't
days?
That with any vaccine, then?
Yes.
Yeah.
Not just flu.
Yeah.
But
If you have a
basically-
blood test, it hurts.
If you
doesn't
have a
it?
splinter, you have a sore finger after a splinter.
Yeah.
So, and I think a splinter
It's not
is
as bad
worse
as
than
an illness that'll put you in
No.
bed for a
No.
week,
No,
is it?
not
at the end of
not
the
at
day?
all.
Going back to your thing about people saying, that's a really common thing I get,
Yeah.
is people say, no, I won't have that vaccine because I got flu or I got COVID after having it. And you can't from either of them. They are dead viruses. You cannot become ill with that virus after having that vaccine. But we give the COVID and flu vaccines when COVID and flu are circulating. So there is going to be a percentage of people who get the vaccine and become ill within the next 7
Before the
14
vaccine's
days.
had its effect.
Yeah. Just like there will be a number of people that will eat a banana within 7 to 14 days, or a number of people that will drive a car within. So it's nothing to do with the vaccine. It's just you've been exposed to it already. You don't feel ill. It's not a symptom that you've got at the moment. You go along and get your vaccine. But if you get ill and you get flu within 2 or 3 days of having the flu vaccine, or COVID within 2 or 3 days, that's because it was already in your body. It's not because of the vaccine. Or it's because you were sat in the waiting room next to somebody else who had it. And that's just unfortunate. We can't give it earlier because to make it effective, most effective, because as you say, it wanes, the immunity doesn't last. So we want it to be most effective when flu is at its peak. And that's why we don't give it in August or July, because by December and January, you've not got the same
the last
immunity.
2 years, the advice has been to don't start the general flu vaccination till October.
Till
Yeah.
October, yeah.
So
Right.
we've delayed it now.
Expecting that flu wouldn't come early.
Yes.
and this
Yeah,
year
Which it has this year,
Yeah,
and
yeah.
normally, so it normally comes around January
Yeah,
time, isn't
yeah.
it? I think the other thing that we said before was, the flu vaccine isn't as good as your own immune system, and I think the other thing that I would say about that, apart from why would you put yourself through that? Why would you put yourself through having an illness when actually you can mimic exactly the same effect through not? But also, what we know is that if someone has had, for instance, flu, that actually their immune system will be dampened down afterwards, so they're much more likely to get
something else up,
bacterial infections and things
Yeah.
like that, pneumonia and
Yeah.
things like that
And-
afterwards.
And
so,
don't forget, if they've had flu, that's just one type of flu.
Yeah.
So in the flu vaccine, we've got 3 strains of flu in that
Yeah.
flu vaccine. So yeah, you may have had flu, but that's still not a reason not to get a flu vaccine, because it may not have been one of those strains. Now, if you've been into hospital, they will test you and can tell you what type of flu you have had, but anyone else at home, you won't have a clue. But why would you risk doing it again?
yeah. Any other myths or
I think
things that patients say?
That illness, that post-vaccination blues, I suppose maybe you should call it. Some people do. If the vaccine is actually working, you do get a little bit of a flu-y illness, but that only lasts 1 or 2 days maximum. So
You can feel a little bit achy, can't you?
A bit achy, a bit like, you don't actually get the disease, but you feel like, but I think that's your immune system actually kicking in. And a lot of people confuse that with having a proper full-on
And again,
Yeah.
paracetamol's a wonderful drug, isn't
and
it?
I usually
It is.
say, you know what, if you're worried about that, as soon as I've given you the jab, go home, take 2 paracetamol now. And then, because I do most of my clinics by 3 o'clock, I say take another 2 before you go to bed. So basically, if you take those 4 paracetamols on the first day, the likelihood of you getting even a sore arm is pretty much diminished.
Yeah.
So would that be a good point to do a general advice anyway?
Yeah, there's no harm. I
So
mean, if you're not allergic to paracetamol,
Yeah.
or if you don't believe, I shouldn't become political, and you don't believe Donald Trump and believe that paracetamol causes autism, So yes, you should take 2 paracetamol.
For clarity, it doesn't.
It doesn't.
Absolutely not, no.
It doesn't. So you take 2 paracetamol after your first jab, 2 paracetamol before you go to bed, and that actually prevents a lot of those achy arms, headachy, people say fluey, but that's only and actually, to me, that's a good sign that the vaccine's working.
It is, because when you become ill, you get achy, you get a temperature, you feel a bit off. That is your immune system producing its own response. Yeah. So when you have a vaccine and that happens, we call it flu-like symptoms, and I don't think that's probably very helpful.
No.
But they are actually immune-boosting symptoms, aren't they? And maybe that's what we should be calling them.
Embrace them.
Yeah. Which also proves that your immune system
is working.
Yeah,
it's doing its job.
Therefore,
but it also doesn't mean that if you're like you and you don't get any, that it's not worked.
Yeah. I mean, and that's why sort of that's where I come from. Maybe it might not be a good idea to advocates of everybody taking paracetamol after, because if you're not having flu-like symptoms after you have the vaccine, don't take the paracetamol.
But I mean, it's actually, paracetamol is a general drug. It's easily, readily available. And most people have got at least a couple of paracetamol in their cupboards. Do you know what I mean? If you're worried, I say take 2. If you're not worried, you don't need to take it. Yeah, 100%. I don't advocate people taking drugs. I'm a pharmacist. I'm actually, half my time is spent stopping people taking unnecessary medicines.
Yes.
So we did touch, I'm going to start wrapping things up a little bit. So we did touch on at the start staying well over winter and saying actually stay well all year round.
Yes, stay well all year round. It will help you. It will, but particularly in the winter.
Yeah, and I mean, I think some of the messages that I, as a public health physician, put out is around that keeping healthy all year round, but also particularly in the winter, like, make sure that in rooms you ventilate. I think we've kind of forgotten those messages from COVID a little bit, and they're just as important.
There's lots of countries in Europe that advocate opening windows even in the winter.
Yeah.
Obviously, if you've got a frail mum at home, you're not going to leave her sitting in a cold room. But open the window in the room for 10 minutes before she comes down into it. Fresh air is actually good for us.
Yeah, I would say. And also make sure that you keep washing your hands, because it's not only flu that's circulating. I mean, I am seeing quite a few outbreaks of TMV, so diarrhea and vomiting illness, norovirus, all that sort of stuff. That again, washing your hands can go a long way. And that thing about, if you cough and sneeze into a tissue, catch it, bin it, kill it. All of that, all absolutely stands and all year round, in fact, but more so in winter when, like I say, we do tend to be inside more. We tend to be gathering
I've also
together.
noticed this year quite a few people have started wearing masks, which is actually, if you're feeling a bit rubbishy and you say, I might have flu, but I really need to go to the shops, if you put your mask on, it stops you either passing it on or actually catching it off somebody if you're particularly vulnerable. So there's no harm wearing a mask.
Very good advice, that.
And culturally, other countries do that.
I mean, if you go to Japan and Korea,
If
you see somebody without a mask, you see what's wrong with them. But as if over here, if somebody has a mask, you think what's wrong with them.
Yeah.
The other
You're
way
right, though.
around.
Since COVID, we do see it much more, don't we?
Because since COVID, it's become more acceptable.
Yeah,
over here. It's not a case because before COVID, if you see somebody wearing a mask, you think, what are you doing? They've got some horrible disease. But now, because of COVID,
you don't assume they're ill. Sometimes you think they're protecting themselves, and it works both ways. And I know that just after COVID, when people got used to not mixing as much during the winter and keeping themselves to themselves and wearing their masks, the people that we would see regularly through the winter with chest infections, those with chronic lung diseases and asthma and things like this, would say, do you know what, I didn't really get any of that. And it's because we were all wearing masks, washing hands, keeping distance. Those things still stand, and there's no reason why. I mean, supermarkets, I think, are great places. If you're a busy mum and you need to shop for your kids, you can be feeling dreadful, but you'll drag yourself out to the supermarket and do that shopping, won't you? Because you need to. So I think supermarkets are a great place to pick up bugs.
To share bugs.
Yeah, if you're vulnerable, put a mask on. Make sure you wash your hands or take some hand gel with you, because you're going to be handling all sorts of things. Those things are really important.
I mean, disposable masks might be expensive, but I don't think they're that expensive. But I mean, if you got any of those cloth ones that you can wash, they're just as reasonably as effective, so long as there is at least 2 or 3 layers of cloth between your face and the outside, you know.
It's always going to be better than nothing, isn't it?
Exactly.
Yeah.
And then if someone does become unwell, if they do have flu-like symptoms, COVID-like symptoms, what's the
Please
advice?
stay at home.
Yeah.
Don't get on the bus or the train that's hot and sticky, and if you are unwell, then don't go to work, don't get on the bus, don't go to your GP unless you're really ill with it, because if you're managing to take on fluids and to eat, if you're managing to keep your temperature down with a little bit of paracetamol, the usual home remedy things that you can do to keep yourself well, sit it out. 2 or 3 days, you should be starting to feel much better. If it's going beyond that, and if you're getting worse, or you've got a chronic condition, then you might need to go and see somebody.
I mean, it's a good time of the year actually to have a little sort of a winter home remedy kit.
Yeah.
In that you should have paracetamol. You should have something like simple Linctus, which is these are the things that you could pick up in every pharmacy, and sometimes even in home bargains or supermarkets and wherever else. And they're quite reasonably priced to buy. If you don't, in Knowsley, we are lucky we got care at the chemist. You can get it through the care at the chemist at the pharmacy if you don't pay for your prescription. So again, we have a lot of good things happening in Knowsley. We look after our population, and we just need them to be able to access those services better. So have some paracetamol, some simple Linctus for coughs, some antihistamine if you're doing a lot of sneezing, and you would do in the summer for hay fever as well, those antihistamines. And generally something to keep your airways open. There's rubs that you could put, like chest rubs and stuff like that, or a stiff that you could put up your nose, that so long as you've not got blood pressure. Some of those sprays have got drugs that make your blood pressure go up, but the stuff that has got a lot of a smell on them, those are smellier stuff. I don't want to mention the brand here. I'm trying desperately
Ask
not
your
to.
pharmacist.
Desperately not. But those winter rubs, I'm calling them, they've got a lot of menthol and eucalyptus and stuff like that in them. And, those things.
Can just help and block your nose, make you feel a little bit easier, relieve the symptoms
that's all
a little
you need
bit.
to do. Paracetamol is a great thing to have in the house, and most people are not allergic. To be honest, in all the years of practice, I've never come across anybody to say, I'm allergic to paracetamol.
Wow.
Some people can't tolerate aspirin because of stomach problems and all that. And in the old days, you used to keep aspirin as well. But aspirin is a bit more risky to say, in general advice, to keep aspirin. But paracetamol is reasonably safe. You can give it to your children. The other one is that with flu, if you got achy and you can tolerate ibuprofen is another good one to have. Because that's really, for muscular pain, ibuprofen is much better than paracetamol.
And then you want a bit of food in the cupboard as well, because you want to feed yourself. If you're feeling ill and I'm saying don't go out, you want to know you can get something out of the freezer, or you can get a tin of soup out, or and some fruit. Tins of fruit are just as good as fresh fruit's expensive. Buy the tins, get the frozen stuff. Some food in the cupboard so that you can feed yourself, because that's going to help you heal as well. Some decent food.
Yeah, and then obviously, if the weather gets colder and you're worried about heating as well, there's all that advice around, try and keep at least one room warm. Wrap up, layers always help, all of that, all those messages.
I think the minimum temperature is 18 degrees, isn't it, or something?
Okay.
You shouldn't have it
Keep
cold.
an eye on the people who are frail and old, if they're your neighbours, they're your family
especially
members.
if they can't move around.
Because it's when you're still you get cold.
I think that's one of the big things that I come from with these vaccinations is, as long as you're healthy, and if you are a carer, you can look after your elderly relative. Yeah. If you become ill, what's going to happen to that elderly relative? You're going to have to either put them into a care home, or you're going to have to get carers in, which is going to introduce more bugs into the house, which is putting them more at risk. So you've got to look after your health to be able to look after others. And that's one of my big points from the side of it.
And that's a really good message to to finish on,
Yeah.
isn't it?
Yeah.
You know,
Yeah.
do it for others as well. So thanks everybody for joining the conversation today. So
Thanks,
we have
Emma.
talked about winter
you.
in general, health in general,
Yeah.
keeping well, but also how important winter vaccinations are for us as well. So if you are eligible and you've not had your flu or COVID vaccine, then go onto the NHS website, Google.
You can just Google it. You
Contact
can just
your
Google.
GP.
You can contact your GP. We still have fridges with flus and in there. We can still get hold of COVID vaccines.
Yeah.
Just call us and ask us.
Or of course talk to your pharmacist as
Yeah.
well.
Always.
Always.
Always talk to your pharmacist. Your pharmacist is the best person to try and get hold of, and the easiest person to get hold of.
And your doctors and your nurses and your pharmacists
Yeah.
will always give you advice if you're worried about them. We
Yeah.
study vaccination. We understand vaccination.
Yeah.
If you've got queries and questions, we're not going to put people under pressure and say,
I was
you
going to
must
say,
do this.
and do it in a non-judgmental way as well.
Yeah.
Come and see us. Come and have a
Completely.
conversation. I promise you we'll give you better advice than Donald Trump.
I have always gone to the pharmacist. If I can't get hold of the doctor, because I know the doctors have got the appointments, etc., but your pharmacist is there,
Yeah.
and always at the end of a telephone. So if you can't get hold of your GP, always check with your pharmacist. And if you've got a good pharmacist, your quid's in.
Sold. Okay, thank you. Thanks again. So you can listen to this episode and all future episodes of In the Know, Health in Knowsley on YouTube and Spotify. So please subscribe and don't miss conversations about health topics that matter to you and your friends and family. So thanks for listening and stay well, everyone.
Thank you.
Have a good winter.
Cheers.